Imagine opening the medicine box you keep at home and discovering that instead of protecting your health, some of those pills may actually be increasing your risk of falling, causing mental confusion, or even leading to an unnecessary hospitalization. This is the silent reality many older adults face daily without realizing it. What seems to be a quick fix for an immediate problem, such as insomnia, chronic pain, or anxiety, can work like a domino piece that destabilizes the entire body. A pill that helps with sleep may slow down reflexes when getting up at night. A painkiller used for months may damage the stomach, raise blood pressure, or interact with another treatment. In this way, the same medication that brings relief today can turn into a trigger for accidents tomorrow. The strength of this topic lies in something science has already proven, but often goes unnoticed. Polypharmacy, which means taking multiple medications at the same time, can become a true invisible trap. Each pill, when taken alone, may be safe and prescribed for a valid reason, but when combined, their effects can accumulate and create risks no one planned for. It is as if each medication were a passenger on a boat, and when the total weight exceeds its capacity, the boat begins to sway. That swaying translates into dizziness, falls, confusion, weakness, or even heart failure. The most dangerous part is that these signs are often attributed to aging when, in reality, they may be directly linked to the pill bottles piling up in the cabinet. This first alert is not meant to create fear, but rather awareness. The good news is that science has already provided clear tools to identify which medications are worth keeping and which need closer monitoring. Among them is the Beers list, an internationally recognized guide that points out which medications should be used with caution in people over 60. This list was recently updated in 2023 and brings recommendations that can save lives. That is why today's conversation is about cleaning out the medicine box, removing what is unnecessary, reviewing what is excessive, and keeping only what truly protects. Such a simple action can make the difference between living with autonomy and facing unnecessary risks. The term polypharmacy may sound technical, but it describes something very common in the lives of people over 60, the use of many medications at the same time. In general, specialists consider polypharmacy when a person takes 5 or more medications daily. However, the number alone does not tell the whole story. The real danger emerges when these different drugs interact, overload the body, and begin generating side effects that could have been avoided. This situation does not occur because older adults like to take medicine, but because chronic conditions such as hypertension, diabetes, osteoarthritis, insomnia, or depression develop throughout life, and each brings a new prescription. In a short time, the medicine box fills with pills for the morning, for the night, for occasional pain, and for emergencies, turning daily life into a complicated puzzle to manage. Polypharmacy, however, is not just a statistical detail. It represents one of the most significant risk factors for falls, hospitalizations, and loss of independence in older adults. Geriatric research shows that the use of multiple medications increases the likelihood of adverse effects ranging from dizziness to kidney or liver failure. Furthermore, the more complex the medication routine becomes, the higher the risk of mistakes, taking a double dose, forgetting schedules, mixing up similar pills, or even confusing different medications. These seemingly small errors can trigger serious consequences. Understanding polypharmacy, therefore, means opening our eyes to a silent problem often seen as normal, but which should not be accepted as such. Another important point is that many older adults do not only take prescription medications, but also over-the-counter drugs, vitamins, supplements, and even medicinal teas. All of this counts toward polypharmacy because every substance consumed needs to be metabolized by the body and may interact with other treatments. A simple anti-inflammatory taken for knee pain, when combined with a blood pressure drug, may cause bleeding or increase the risk of dizziness and falls. The sum is invisible, but the outcome is concrete. That is why the first step to protecting health is recognizing that polypharmacy does not simply mean many pills, but rather a warning to evaluate every medication together, not in isolation. What few people realize is that every pill that enters the body does not act alone. It must be processed by the liver, eliminated by the kidneys, and distributed through the bloodstream. Along the way, it may encounter other medications undergoing the exact same process. It is in this encounter that drug interactions arise. In simple terms, it is as if two medications start talking to each other without anyone inviting them to the conversation. The result may be an exaggerated effect, such as a sudden drop in blood pressure, or the opposite when one drug cancels out the effect of another. Many times people do not associate symptoms such as dizziness, excessive drowsiness, or loss of appetite with this silent combination happening inside the body. These interactions are even more dangerous because they do not appear immediately, like a sudden allergy. They develop slowly, day by day, until they become confused with the natural process of aging. An older person may begin to feel unsteady and believe it is just advanced age when, in fact, the problem stems from the combination of an anxiolytic and an antihypertensive. Similarly, memory or reasoning difficulties may be linked to prolonged use of anticholinergic medications, not the onset of dementia. This masking makes the risk underestimated, delaying the search for solutions and keeping the person in danger. Another serious aspect is that interactions do not involve only prescription drugs. Supplements, vitamins, and even common teas can interfere with treatment. St. John's wort tea, for example, is sometimes used to relieve mild depression symptoms, but can reduce the effectiveness of prescribed antidepressants, altering the expected result entirely. Likewise, the continuous use of anti-inflammatory drugs for joint pain can increase the risk of bleeding when combined with anticoagulants. These are silent traps that accumulate over time. That is why medication review becomes an essential tool, looking not only at each pill individually, but at the entire set a person consumes, identifying where risk overlaps are hiding. The so-called Beers list, or Beers criteria, may seem like a technical document meant only for doctors, but in practice, it is a guide that saves lives. Created by the American Geriatrics Society, this list brings together the medications that should be avoided or used with caution in people over 60 because they present more risks than benefits in this age group. It works like a lighthouse, alerting healthcare professionals about which drugs may cause falls, mental confusion, memory loss, low blood pressure, or serious complications when used by older adults. The most recent version, updated in 2023, is the result of decades of research, scientific reviews, and analysis of thousands of clinical cases, always with the goal of guiding safe care for the elderly population. What makes the Beers list unique is that it does not simply cite drug names, but organizes entire categories of medications that deserve special attention. It shows, for example, which sleep medications increase the risk of fractures, which painkillers can damage the stomach or kidneys, and which allergy drugs compromise memory and focus. For older adults and their families, being aware of this list is a way of gaining a stronger voice during medical consultations. It is not about stopping medications on your own, but about bringing smarter questions to the doctor. Is this drug on the Beers list? Is there a safer alternative for my age? That simple question already opens the door to a careful review and strengthens the partnership between patient and healthcare professional. It is also important to understand that the Beers list is not a rigid ban, but rather a guideline. This means that in some cases, even medications considered risky may still be prescribed, provided there is a solid clinical justification and close monitoring. The value of the list lies precisely in illuminating the critical points, helping to weigh risks and benefits. For the elderly person, this knowledge translates into greater autonomy and safety. For the physician, it is a resource that organizes decision-making. And for the family, it is a tool to actively participate in care, identifying when the medicine box truly needs a cleanup. Within the Beers list, some groups of drugs appear repeatedly because they are widely used, and at the same time carry very clear risks for people over 60. The first group are benzodiazepines, popularly known as medications for sleep or anxiety control. They may indeed provide relief in the short term, but in older adults they tend to cause daytime drowsiness, slowed reflexes, and increased risk of falls, in addition to favoring dependence. When used for weeks or months, these drugs can compromise memory and attention, confusing their effects with signs of dementia. Science shows that in older people, the body takes longer to eliminate these substances, leading to the accumulation of undesirable effects. The second group are anticholinergics, which include certain allergy medications as well as treatments for overactive bladder and gastrointestinal problems. These drugs block a neurotransmitter called acetylcholine, essential for memory and reasoning. In older adults, prolonged use may lead to mental confusion, concentration difficulties, and even delirium in severe cases. It is no wonder that many specialists point to them as one of the main silent villains of polypharmacy. In addition, they cause dry mouth, increase the risk of constipation, and may worsen glaucoma, showing that their side effects impact multiple areas of the body. The third group worth highlighting are non-steroidal anti-inflammatory drugs, NSAIDs, often used chronically for joint or muscle pain. Despite being easily available in pharmacies and seeming harmless, these drugs can cause stomach bleeding, raise blood pressure, and harm kidney function. When combined with other medications such as anticoagulants or diuretics, the risks increase significantly. The problem is that many older adults take these anti-inflammatories for long periods without medical supervision, believing they are simply managing their pain. In reality, they are increasing the chances of serious complications. These three groups, benzodiazepines, anticholinergics, and chronic NSAIDs, are concrete examples of how common drugs can turn into traps for people with more sensitive bodies. The good news is that safer alternatives exist in many cases, but switching must always be done under medical supervision. Recognizing these names and knowing how to ask about them during consultations is an essential step in transforming the medicine box into an ally, not a threat. The numbers reveal a worrying reality. Estimates suggest that more than 30% of hospital admissions for older adults are related to adverse drug effects, many of them completely preventable. This means that thousands of falls, fractures, and episodes of mental confusion could be avoided with a simple medication review. A recent study published in international geriatrics journals showed that older adults taking 5 or more medications are twice as likely to suffer adverse events compared to those taking fewer drugs. These numbers are not abstract. They represent real people whose independence was compromised by seemingly harmless pills. Imagine the case of a 72-year-old woman who was taking anxiolytics for sleep, anti-inflammatories for knee pain, and medication for high blood pressure. After a few weeks, she began experiencing frequent dizziness and suffered a fall at home, resulting in a hip fracture. At the hospital, doctors realized the combination of medications was causing low blood pressure and excessive drowsiness. The accident was not merely the result of aging or chance, it was a direct consequence of polypharmacy. This type of situation is far more common than it seems and unfortunately affects not only health, but also independence, since many people require constant support after a serious fracture. Another striking example comes from a 68-year-old man who was using medications for overactive bladder, along with antidepressants and antihypertensives. He began to experience episodes of mental confusion and memory loss, and was initially evaluated for possible early dementia. Only after a careful review was it identified that the combined use of drugs with anticholinergic effects was harming his reasoning. With adjustments to his medication, the symptoms disappeared, showing how easily the confusion could have been avoided. Cases like this highlight the importance of distinguishing between the effects of aging and the adverse effects of poorly managed treatments. These stories repeat themselves in hospitals around the world, which is why organizations such as the American Geriatric Society and the World Health Organization stress the importance of regularly reviewing older adults' medications. Science shows that when medication lists are simplified and adjusted, quality of life improves, the risk of falls decreases, and hospitalizations become less likely. It is an investment in health that does not depend solely on new technologies or expensive drugs, but on paying close attention to what is already inside the bedside drawer. One of the most important steps in reducing the risks of polypharmacy is the so-called guided medication review, a simple practice with enormous impact. It consists of gathering all the medications a person uses, prescribed drugs, over-the-counter medications, vitamins, supplements, and even medicinal teas, and taking everything to a medical appointment. Many older adults believe they only need to show their doctor the prescriptions that came directly from them, but this is one of the biggest traps. In practice, each specialist usually focuses only on their area. The cardiologist looks at the heart, the rheumatologist at the joints, the psychiatrist at sleep and anxiety. The one who suffers is the patient, caught in the middle of overlapping prescriptions. That is why the guided review creates a complete picture of what is truly being consumed, allowing the identification of duplications, dangerous interactions, and unnecessary drugs. This review is called guided because it follows key questions that help the doctor and patient reflect together. Is this medication still necessary? Is it still effective? Is there a safer alternative for my age? Is the dosage correct, or can it be reduced? In many cases, the answers reveal that certain medications were started for a specific need, but were never discontinued. It is common to find medications that should have been taken only for weeks but have remained for years, accumulating side effects. With the review, these excesses can be safely removed, providing immediate relief and reducing the number of daily pills. A medication review should not be seen as a confrontation with the doctor, but as a partnership for better health. A patient or family member who arrives at the appointment with all the bottles organized and a simple usage chart sends a clear message. They want to actively participate in their own care. This makes the doctor's work easier, since they now have a complete overview to adjust treatment. Studies show that older adults who undergo periodic reviews significantly reduce the number of falls and preventable hospitalizations. It is a low-cost strategy, accessible to anyone, that can completely transform quality of life. The cleanup of the medicine box does not start only in the doctor's office. It can begin at home, with a careful eye on simple warning signs that make all the difference. The first step is to check for duplicate medications. Often the same active ingredient appears under different brand names, leading to dangerous duplication. It is common to find, for example, 2 pills for pain or blood pressure that in practice are the same drug. The second step is to check for boxes without package inserts or with unreadable labels. Taking a pill without knowing exactly what it is opens the door to mistakes that can have costly consequences. Another essential item is checking the expiration date. Expired medications not only lose effectiveness, but can also turn into toxic substances in the body. In addition, it is important to evaluate physical organization. Loose bottles, pills stored outside their original packaging, and mixtures in improvised containers increase the risk of confusion. Using weekly pill organizers with compartments for morning, afternoon, and evening can greatly help with routine. The checklist should also include attention to recent side effects: dizziness, excessive drowsiness, loss of appetite, memory decline, or muscle weakness. If these symptoms appeared after starting a new medication, it is a clear sign it needs urgent review. It is also important to remember that it's self-medication and the use of borrowed drugs from relatives or neighbors are extremely dangerous practices. What works for one person may be harmful to another, especially for those already living with multiple chronic illnesses. The checklist, therefore, is not just about organizing boxes, but about creating awareness. It turns the review into a continuous habit. Every time a new drug is added to the routine, it should be evaluated in the context of what is already being taken. This home-based care prepares the ground for a more efficient consultation, ensuring the doctor has all the necessary information to adjust and simplify treatment. Many older adults are afraid of questioning their doctors about the medications they take, fearing they may seem disobedient or ungrateful. But the truth is that a medical consultation should be a dialogue. An informed patient helps the doctor make better decisions. That is why it is essential to learn how to conduct the conversation with clarity and confidence. One of the most powerful questions one can ask is, "Doctor, do I still need this medication?" That simple phrase opens the door to evaluating whether the drug continues to bring more benefits than risks. Another important question is there a safer alternative for my age? This question directly refers to the Beers list, which already indicates which medications have higher risks in people over 60. Another practical way to talk is to present the doctor with an organized list of all medications used, including vitamins and supplements. This prevents forgetfulness and shows commitment to one's own health. During the consultation, it is also worth asking, what is the minimum effective dose I can take? Often, side effects are linked to higher doses than necessary. Adjusting the amount can maintain effectiveness while reducing risks. Asking about duration of use is also essential. Is this drug for continuous or temporary use? This avoids situations where medications meant for weeks end up being taken for years. It is important to remember that doctors are used to dealing with patients who do not provide complete information, which makes diagnosis more difficult. That is why, when an older adult or family member arrives prepared with questions and notes, the consultation becomes more productive. It is not about confronting or distrusting the professional, but about actively participating in treatment decisions. This attitude strengthens mutual trust and increases the chance of adjustments that bring greater quality of life and lower risk of complications. A good conversation can make the difference between continuing a pill that causes dizziness or replacing it with an alternative that preserves independence and reduces the chance of falls. To turn information into practical action, one of the most valuable resources is the Talk to Your Doctor. What to Review worksheet. It works like a simple yet extremely effective map for organizing all daily medications. The idea is to fill in columns with basic data: name of the medication, dosage, time of use, the reason it was prescribed, and which doctor was responsible. This structure, which may seem obvious, is often missing in the daily routine of older adults, who end up relying only on memory or scattered notes. Having everything in one place not only makes self-organization easier, but most importantly facilitates review during medical appointments. The worksheet also includes a space for notes about perceived side effects, such as dizziness, drowsiness, lack of appetite, or episodes of mental confusion. This record is crucial because it allows the doctor to identify connections between symptoms and specific medications. In addition, there is a field reserved for duration of use. Many older adults do not remember when they started taking certain drugs, and this detail can be decisive in determining whether they should continue. Another useful feature is the column for questions to ask the doctor, encouraging patients to come prepared to discuss each item. This worksheet can be printed and updated whenever there are changes, serving as a health monitoring document. For family members involved in care, it becomes a safety tool, reducing the risk of errors when administering medications. Moreover, in emergencies such as an unexpected trip to the emergency room, handing the worksheet to the medical team ensures everyone has a clear view of the older adult's medication history. It is a simple, low-cost instrument with the potential to save lives. This is the essence of cleaning out the medicine box, not only removing excesses, but also creating tools that make care safer, more transparent, and participatory. At the end of this journey of reflection, the key message is clear. The medicine box should not be seen as an inevitable burden, but as a space of care that can and should be organized consciously. Each bottle reviewed, each pill removed or adjusted, represents a silent victory against falls, hospitalizations, and loss of independence. It is not about abandoning essential treatments, but about ensuring that each medication is truly fulfilling its role without putting health and quality of life at risk. Cleaning out the medicine box is, at its core, an act of preserving autonomy. Taking care of one's health is not only about following prescriptions, but also about actively participating in the process, understanding what is being consumed and why. Having the courage to ask questions, record symptoms, organize information, and share doubts with healthcare professionals strengthens trust and puts the older adult at the center of care. Science has already shown that small changes in this direction drastically reduce complications and extend healthy life expectancy. By applying the checklist at home, using the review worksheet, and engaging in open conversations with the doctor, each person takes concrete steps toward living with greater safety and peace of mind. The final message is one of hope. Even if polypharmacy is already part of your routine, it is never too late to adjust. Each review can reveal opportunities for simplification and improvement, transforming the medicine box into an ally rather than a threat. Knowledge of the Beers list and of dangerous interactions should not frighten but empower. The true cleanup begins with information, organization, and action, because in the end, the most powerful medicine is the one that allows you to live longer with clarity, balance, and dignity.